My name is Kwan Kew Lai, the class of Chicago Medical School of 1979. I would like to thank the editorial board of Synapses, the Chicago Medical School's creative journal, for inviting me to speak about my essay, Healthcare in War-Torn Yemen, at the annual Synapses Salon. My motivation to write this story is to make sure that the world does not forget that Yemen is still in the midst of war. There will always be many other events happening in the world to distract us, and so there is a danger that Yemen may be forgotten. The war in Ukraine now takes center stage. Yemen's civil war started in 2014 when the Houthi Shiite rebels rose against the Sunni government and took control of Sana'a, the capital. The Saudi-led coalition, which includes many Western countries, including the U.S., participate in the war. The Saudi-led naval blockade, in which U.S. Navy is a partner, contributes to the outbreak of famine. Right now, Yemen has the world's largest humanitarian crisis, with 24.1 million people in need, and about 10 million of them on the brink of starvation, especially in the Houthis-controlled northern heartland of Sana'a province and the neighboring areas. When my invitation from Med Global came requesting for medical volunteers at Yemen, I was excited to witness the impact of war on healthcare. To be there in the field opened my eyes, and I need to share what I observed with the medical world. We visited 2 government hospitals, Sayoun General Hospital, a 75-bed hospital in Sayoun, the Hadramaut Governorate, and Kara General Hospital, a 100-bed hospital in Marib Governorate. Kara General Hospital is only 75 miles west of Sana'a, the capital, controlled by the Houthis. We traveled for 5 hours through the desert, escorted by the military, and stopped at numerous checkpoints. Our trip was postponed for a couple of days when missiles hit a military base in Marib. Many healthcare workers have adapted to the changes in war, and many more moved away from Marib to be away from the daily missile attack. They have adapted to the resource-limited situation, but the basic infrastructure of the hospitals needs an emergent overhaul. Our mission was to help the staff see patients in the clinics, the hospitals, and to teach and transfer clinical skills to the healthcare personnel. Being an infectious disease doctor, I concentrated my efforts on infection control. There were several things that were sorely lacking. Number 1, the lack of hand-washing facilities, soaps and hand sanitizers. In crucial areas such as the intensive care units, emergency rooms, and surgical wards, these facilities and supplies were lacking, making transmission of infection easy. A surgeon rounded on a ward of 30 patients without ready access to hand washing. I also observed the lack of sharp containers, especially in the oncology ward, and needles were discarded in regular trash. There was a lack of medicines and equipment. I observed a fracture being reduced without pain medicines. There was no intramedullary rod to fix a broken femur, despite scouring the city for that piece of equipment. Obviously, the lack of medical staff. This is obvious as some staff evacuate themselves and their families to be far away from the war zone as possible. I hope through this piece I'm successful in conveying the devastating ravages of war, not only on people's daily lives, but also in healthcare. It is estimated that a child dies every 10 minutes from starvation in a war in Yemen. If we ever learn our lessons, war should never be a solution to solve any of the world's problems. As a clinical researcher, publishing scientific articles after a period of clinical investigation is required of the faculty in academia. Scientific papers are often cut and dry, presenting the facts and supporting one's conclusion on them. Narrative writing in medicine allows the physician to be creative, drawing on prose that only literary writers are masters of. I first became interested in humanitarian work when I was a teenager, after reading about Dr. Tom Dooley, who went to Laos and Cambodia to set up hospitals for the poor. I was inspired by his selflessness. In 2006, I left my position as a professor of medicine to dedicate time to humanitarian work in HIV/AIDS in Africa and to provide disaster relief all over the world during war, famine, and natural disasters, including the Ebola outbreak, the Syrian Rohingya refugee crisis, Yemen, and the COVID-19 pandemic in New York. I'm a 3-time recipient of the President's Volunteer Service Award. Chicago Medical School awarded me the Distinguished Alumni Service Award a few years ago. I wrote about my volunteering experiences into books, bearing witness to the plight of the people who needed help. I'm the author of Lest We Forget, A Doctor's Experience, Life and Death During the Ebola Outbreak. This is about my experiences volunteering in the greatest Ebola outbreak in the world. Into Africa, out of academia, a doctor's memoir chronicles the time I spent in Africa on and off for about 6 years doing HIV/AIDS education during famine and working with refugees and internally displaced people during the Arab Spring in Libya. My latest book is The Girl Who Taught Herself to Fly. It is a memoir. It is about my life, struggling with how to get out of abject poverty and to apply to U.S. college, which would also offer me a scholarship to continue my education. Wellesley College was the college that awarded me a full scholarship, a ticket to my becoming a doctor. I was a dentist before I was a doctor. My last year of Harvard School of Dental Medicine was when I decided to be trained as an oral surgeon, a challenging specialty. As I did my round of interviews for fellowship training, the chief of oral surgery at Vanderbilt deliberately made me wait for him for an hour for my interview. He expressed his surprise when I was still waiting for him. He told me that I was more qualified than many of the male applicants he interviewed. He questioned my motivation for wanting to be a woman or a surgeon. He told me that if I should go on to get a medical degree and reapply to his program, I would be even more qualified, and that he might consider me then. At that time, there was only one female oral surgeon in the whole country. His comments made me think very seriously that it was time for me to pursue what I truly love, medicine. That day, I made up my mind to cancel all my other oral surgical interviews. It was already late in the year, but I applied to 3 medical schools. In the end, Chicago Medical School accepted me as a 3rd-year medical student. The financial department also helped me by providing resources where I could apply for financial aid to fund my 4th year of education. By accepting me as a medical student, Chicago Medical School helped me fulfill my dream of helping others. For that, I'm truly grateful. Thank you.